Autosomal trisomies can happen when 3 homologous chromosomes are present in a zygote instead of the normal set of 2. So this here that I'm showing you is a normal karyotype in which you can see 2 copies of each chromosome, but if there were 3 copies instead of 2 for any of these, that would be a trisomy. By the way, do you think this is a male or a female karyotype? This is from a male, which you can tell because the bottom right corner here has the sex chromosomes, and one is shorter than the other because it's the Y chromosome. So how does a trisomy happen? Well, the most common cause is meiotic non-disjunction, which is when a chromosome fails to separate during meiosis. Now remember, meiosis has 2 steps, meiosis 1 and meiosis 2. So having non-disjunction in either step causes a different outcome. Alright, so here are our chromosomes. We're only showing 2 out of the 23 chromosomes here, and I'll call them blue and orange. Each of our 23 chromosomes would have 4 sister chromatids, and why is that? Because there should always be 2 in a diploid cell, one from your mom and one from your dad, and these are genetically different, but they're homologous chromosomes, and then each of these has 2 sister chromatids. So when would you have both homologous chromosomes but only 1 chromatid for each? That would be in G1 or G0 phase, because only in S phase does each chromosome double itself to form 2 sister chromatids. So any cell that's quiescent and not dividing should only have 1 chromatid for each homologous chromosome, since a cell will only go through S phase and double its DNA if it's committed to dividing. Alright, so back to our example. The orange chromosome does everything right the whole time in this left example here. So you can consider this the normal case. The blue one in the left example here, you can see that it's something different from the very beginning, in meiosis 1. Notice how both homologous chromosomes, or all 4 sister chromatids, stick together instead of separating. This is non-disjunction in meiosis 1. Okay, so what's going to happen here, assuming nothing else goes wrong? Well, the orange chromosome is still behaving itself and ends up with 1 chromatid in each gamete, as you'd expect. But for the blue chromosome, we're going to end up with 2 copies in each of 2 gametes, and 0 copies in the others. Okay, so I said 2 copies, so why is this a trisomy? Well, that's because this gamete contributes 2 chromosomes, but this is either an egg or a sperm, so the other gamete, which comes from the other parent, will contribute another chromosome, and you'll end up with a total of 3. So that's a trisomy. These other 2 gametes can create a monosomy, again not because there's 1 orange chromosome, but because there are 0 blue chromosomes, and the gamete that it pairs with will have 1, and 0 plus 1 is just 1. Alright, so a similar thing is happening on the right example, but this time everything goes right in meiosis 1, and meiosis 2 is a problem. So again, with the 2 blue chromosomes in the same gamete, this can lead to a trisomy. And with 0 blue chromosomes in the other gamete, what will this cause? Right, a monosomy. And I just want to point out that both trisomies and monosomies can be caused by either non-disjunction in meiosis 1 or meiosis 2. The 3 most common trisomies are trisomy 21, or Down syndrome, trisomy 18, or Edwards syndrome, and trisomy 13, or Poteau syndrome. Trisomies of the other chromosomes are not viable. Down syndrome is the most common, with a prevalence of 1 in 700 people, and is the most common cause of intellectual disability. Patients often have several classic characteristics, including flat faces, prominent epicanthal folds, which are the folds of skin on the medial aspects of the eyes, and a single palmar crease, which means there's only 1 fold of skin across the palm. They can also have a gap between the first 2 toes, duodenal atresia, and congenital heart disease. And they have an increased risk of acute lymphoblastic leukemia. Lastly, these patients have an increased risk of Alzheimer's disease, which they can get at younger ages. The most common cause of Down syndrome is meiotic non-disjunction, which becomes increasingly common with advanced maternal age. At the age of 20 or younger, this non-disjunction occurs in about 1 in 1,500 pregnancies, whereas in women over the age of 45, it increases to about 1 in 25 pregnancies. More rarely, it can be caused by Robertsonian translocation, which I'll talk about soon, or Down mosaicism, which is when non-disjunction occurs very early in embryogenesis, rather than during gametogenesis, so it only affects some cells. Down syndrome can be diagnosed during pregnancy using ultrasound in the first trimester, on which a fetus with Downs will have what they call increased nucleotranslucency. And what this means is how wide this translucent, or black area is here, at the back of the neck. So that's done during the first trimester, and in the second trimester you can diagnose Down syndrome using what's called a quad screen of maternal serum, since you test 4 things. which are alpha-fetoprotein, beta-HCG, estriol, and inhibin A. If the baby has Down, alpha-fetoprotein and estriol will both be decreased, whereas beta-HCG and inhibin A will both be increased. Edwards syndrome is the next most common trisomy after Down, with a prevalence of 1 in 8,000. It's much more severe than Down syndrome, and patients have severe intellectual disability, rocker bottom feet, small jaws and low set ears, clenched hands like you can see here, a prominent occiput, and congenital heart disease. These babies are usually born alive but die within 1 year of birth. On the quad screen, maternal serum is usually low for all 4 of these markers, although inhibin A can also be normal. The least common trisomy is Patau syndrome, which occurs in only 1 in 15,000 pregnancies. They have similar findings as Edwards syndrome, such as the rocker bottom feet and congenital heart disease. However, they also can be distinguished from Edwards because they have small eyes and a small head, extra fingers, which you can see here, a cleft lip or palate, and in some cases holoprosencephaly, which is when the prosencephalon fails to develop into 2 hemispheres, which can cause fusion of bilateral structures such as the eyes across the midline. Babies with Patau syndrome usually die soon after birth. For this one, we won't use a quad screen in the 2nd trimester, but in the 1st trimester, you'll see low beta-HCG and low PAPPA, which, by the way, you would also see in the 1st trimester during Edwards syndrome, and also an increased nuchal translucency like I showed you in Down syndrome.